semua, Anda bersama dengan Mam Leoni dan hari ini kita akan membahas topik diabetes ataupun kencing manis. Kita sebagai wanita dan apalagi kita yang mau mencoba hamil, apa itu gejalanya kencing manis? Efeknya kepada baby dan kesehatan kita secara keseluruhan. Kita akan berbicara dengan Dr. Daniel Y di Mount Elizabeth Medical Center di Singapura dan kita akan bersama-sama cari tahu lebih lanjut tentang kencing manis dan diabetes.
A lot of people think that diabetes is something that is not common or it won't affect them. They don't relate themselves to it. But that is actually not true. The most recent figures from Jakarta shows that actually about 12.4% of the residents in Jakarta has diabetes. And also the more worrying trend is that more and more young people are getting it. We used to think that diabetes is something that people get in the middle ages, like 50s, 60s, but now that is no longer the case, and that's primarily because people are getting fatter, and especially the younger males. We have actually recently done a study in Singapore, and Jakarta is really pretty much like Singapore, and we find that the people who are getting fatter are the younger men. So also we know that the rate of obesity or people getting more fatter in Jakarta are about at least the same as Singapore, and more young people are becoming obese. In fact, according to this research in Jakarta, about 47% of the men and women who are younger in Jakarta are already overweight or obese, and that is really a huge healthcare concern. What are the dangers of suffering from diabetes? Diabetes is a lifelong disease, and therefore if the sugar is always high, it's going to affect and damage some of the organs, and namely the heart, so patients can have higher chance of having heart attacks, stroke, kidney failure, and the nerve damage. And some of the patients also have problems with the arteries that supply to the legs, and sometimes they may need to end up with amputation, unfortunately. So doctors are very concerned about all these possible complications, and we always try to have the patients achieve good diabetes control. So if one already has diabetes and yet plan to have a baby, then what the person should do is to talk to the doctor, get some advice. The most key important thing here is to have the diabetes under control first. So once the diabetes is well controlled, then there shouldn't be much of a problem, whether it be trying to get pregnant or sort of complications that can develop during pregnancy. During pregnancy, we are generally more careful about diabetes control, so therefore we would be much stricter than in a non-pregnant situation. And what happens is that we do not recommend taking diabetic drugs during pregnancy. So therefore, once we know that the patient with diabetes has become pregnant, then we will always switch to insulin injection. And that insulin injection can be sort of 2 times a day or 3 times a day. But it is really not that scary once you've gotten used to it.